We call this as DMP, Doctor's Meet Program, because in CLE there will be some expert dealing on that particular topic. I'm quite younger to you, quite junior to you, but I would rather have try to have a conversation, one-to-one interaction with you, and let's just improve each other's knowledge by interaction. So doctors, I work in Maharashtra, and being in Maharashtra I had to travel a lot, and during one of my travel I came across my train journey was there, a night train journey, and I was traveling with a elder person was there who was having a lower berth. I was in a middle berth, so he was continuously going for his washroom. He was using washroom quite often, like every half an hour he was using. And फिर एक क्लिनिशियन जाग गया फिर दिमाग में कि यार ये क्या हो सकता है, इनको एक तो फिर डायबिटीज होगा या फिर बीपीएच, इन दो में से ही कुछ हो सकता है, most probable diagnosis. So I just asked him what it is exactly you are having. Do you have any medical condition? He said, yes, I am having BPH, benign prostate hyperplasia. So thing is that doctor, the last thing which is needed for a 60-year-old male, that his family with not being with him, his every duty has been fulfilled, but last thing he would need is being a patient of BPH. So doctors, you all know, you being urologist, you are quite aware of this particular condition. It is said that 10 million people in India every year are diagnosed with BPH. That is like entire Chennai city getting infected with getting BPH at the same time. So quite a horrible condition, isn't it, Dr. Usman? Entire Chennai city suffering from BPH is quite a horrible situation. So doctors, we know the treatment protocols. We know TURP, transurethral resection of prostate, but it is having their own limitations. You can't operate each and every patient, especially in Indian scenario. The patient will be fearing a lot. They will be not getting ready for operating at all in first visit. And there are so many other treatment protocols, like use of alpha inhibitors like tamsulosin, and there are 5-alpha dehydroxy inhibitors like we have finasteride. But we know they are having their own side effects, and they are very well documented, very well known side effects are there. First of all, they may have increasing sexual dysfunction may arise there. There may be chances of having impotency or chances of having low libido, and only men will understand how severe these conditions are. Men will be men, and they will only understand how difficult it is to deal with this condition. So doctors, presenting here from the house of Himalaya a drug that will help your patients to manage this benign prostate hyperplasia. We are bringing to you Himplasia tablets. Himplasia tablets containing Varuna, which is known to have 5-alpha reductase inhibitor activity, and which is the foremost important quality which we require in our medication. Because we know the artificial 5-alpha reductase inhibitor, it's having its side effect. But this being a completely herbal formula, there will not be the side effect which we previously discussed. Also, we have puga, or rather, जो सुपारी हम खाते हैं हमारे इसमें, and you might have come across thing that when you are chewing raw supari, this catechu, areca nut, raw areca nut, you might feel some sudden pain in your stomach. It is because of that muscarinic receptor inhibitor activity, agonistic activity is there, and this is what improving the patient's scenario here. BPH के जो patient में muscarinic receptor inhibitor activity हमें मिलती है, that is going to help a lot in our patients. As well as we have Gokshura, very well known herb for the management of various urinary conditions, and here we can say it is known to have COX-2 inhibitor activity, which is again with 5-alpha reductase inhibitor, again a fantastic synergistic activity will be found, and it will be helping a lot in our patients.